Hello, everyone. My name is Guillermo Perez. I am a labor educator with the USW Education and Membership Development Department. I want to welcome all of you to the first of a series of conversations the Education Department will be hosting over the coming weeks on important issues impacting our members and the labor movement generally. The first installment of this series is devoted to the topic of the impact of the current coronavirus pandemic on immigrant workers, and most especially undocumented immigrant workers. We are recording this session on Monday, April 27th, 2020, in anticipation of this Friday, May 1st. As most of you know, I hope, May 1st is May Day, International Workers' Day, a day devoted to uplifting workers that's celebrated all over the world, including right here in the United States. Here in the US, May 1st has become a day of mobilization in support of immigrant rights. This dates back to May 1st, 2006, when millions of immigrants and their allies skipped out on work and took to the streets across the country in what organizers called a day without immigrants. Since 2006, immigrant rights activists have used May 1st as a day to focus on the plight of the estimated 10.5 million undocumented people residing in the United States. So though we're recording this webinar a few days before May Day, we hope to use the release of it to promote the many online activities that will be taking place in support of these workers on May Day. And one of those activities will be a live Q&A with one of our guests on this webinar, Yanira Merino. Yanira is the National President of the Labor Council for Latin American Advancement, LACLA. For those who don't know, LACLA is the Latino House of Labor, one of 6 AFL-CIO constituency groups. LACLA is a national organization with local chapters across the country dedicated to advocating for and organizing Latino workers here in the United States. On May Day, we will be talking to Yanira about a recent report LACLA issued titled The Impact of COVID-19 on Latinos in the US. But for this recorded webinar, we wanted to focus on another important report recently issued, this one by the AFL-CIO, titled COVID-19 and Immigrant Workers. Joining me and Yanira to discuss the report is the Director of Immigration Policy for the AFL-CIO, Shannon Lederer. Welcome to you both. So before we review the AFL report's key findings, we should say that this report really zeroes in on the major shortcomings of the recently enacted series of federal emergency relief packages passed by Congress. So Shannon, why was it important, do you think, for the AFL to focus on the federal response to this pandemic?
Hi, thank you, Guillermo, and thanks so much for this opportunity to connect with Steelworkers and to discuss this really critical topic. I think the pandemic has been a powerful reminder of just how interconnected workers are in this country, and we are all in this fight together. And so I think it's been critical that we bring the collective power of the labor movement together to try to ensure the strongest possible national response. And as we've already seen, our state strategies have been very uneven. And if we want to ensure that all workers are going to have safe environment and the protections and support that they deserve, obviously it's critical that the federal response make those mandates and those commitments clear. And so to us, in advocating for those federal packages, when it became clear just how huge the gaps were going to be for millions of working people in our country based on their immigration status, we really thought that it was essential that we document that and create a bit of a blueprint for ourselves so that we understand what's at stake if we continue to allow these exclusions in the basic protections that our federal government is offering, and that we combine forces to try to have a response package that protects all workers regardless of immigration status.
Okay, and then just a quick question for Yanira. We know that here in the United States, more than a third of Latinos are foreign-born, which is to say they are immigrants. Is that why the plight of immigrant workers is so central to LACLA's advocacy?
Yes. Hi, Guillermo. Thank you very much for having this, and thank you to Steelworkers for inviting us to discuss such important issue. Yes, I mean, the mission of LACLA is to lift up the issues that affect Latino communities, and given that immigrant workers are close to 16.5% of the workforce in this country, we think in LACLA, and we live, as I said, once again, our mission it is to represent and lift those issues and advocate for not only what they're going through, but how are we going to improve their lives.
All right, so let's start off by looking then at some of the subject areas that the AFL-CIO report covered. So we start off with looking at accessing to testing and treatment. So first of all, there's no protection in any of this federal legislation from out-of-pocket costs for treatment relating to COVID-19. And the AFL estimates that the cost of treating folks who have complications from COVID-19, if they should have to be hospitalized, those could run anywhere from $10,000 to $20,000. The average deductible for insured workers with single coverage is $1,400. That's a considerable amount of money for working families. And in addition to this, we also know that 20% of immigrants, foreign-born folks here in the US, and half of undocumented folks have no insurance at all. And undocumented folks, as well as DACA and TPS holders, are excluded from Medicaid coverage. Now, we're going to talk later more about the situation for DACA and TPS holders. DACA is the Deferred Action for Childhood Arrivals. This is more commonly known as the Dreamers, young people who came to the United States without authorization. This was something that President Obama was able to put into place by way of executive action. It gave hundreds of thousands of young people work authorization and status. Similarly, TPS, this is temporary protected status. This again affects hundreds of thousands of folks who came to the US because of crisis conditions in their home countries. They are all in jeopardy. We're going to talk more about that. But at the very least, these are hundreds of thousands of immigrants who have status and work authorization and but nonetheless are also excluded from Medicaid coverage. And as a result of all of this, these folks, these hundreds of thousands of folks will have no, I should say millions, because we're including the undocumented, will have no guarantee of free or low cost testing. And there's nothing provided for treatment or a vaccine when we have a vaccine. So Shannon, very quickly, what are the AFL's concerns regarding this?
Right, so as with so many things with this pandemic, it didn't actually create this problem with immigrants being excluded from our healthcare system, but it really reveals the injustices and the dangers of those exclusions from a public health perspective. So, you know, the fact is that we have millions of people who have been excluded from Medicaid coverage, even new green card holders. And even in the context of this emergency Medicaid COVID expansion, those restrictions continue. And so this is, you know, it's clearly wrong, and it's dangerous. And so this is one of the most fundamental fixes that we know we need. We need everybody to be getting tested. We need much more testing, and obviously it's in everyone's interest for us to ensure that people have access to the treatment and vaccines that are going to help us get our country back running again.
And Yanita, we also know in the LACLA report, and we'll focus on the LACLA report when we do our live Q&A, that Latinos are one of the demographic groups here in the US who have the lowest rates of insurance, right?
No, yes, definitely. And among Latinos, as you mentioned, as it was mentioned already, the undocumented workforce the numbers are high. And we also know that because of not having that, their practice is that they don't go to the doctor, not even, they leave that to the as a last resource. Many of them will go to work. Many of them will go to work sick. not only because they don't have insurance, but because they need to survive. And on top of that, many of the essential workers or nominated essential workers are low-wage workers, farm workers, people who works in stores, grocery stores, people who's taking care of the elderly in this country. What will happen if they don't go? But what will happen if they continue going and they don't, and they're sick? So all of these are issues that are affecting directly to Latinos, and it's based on what Shannon already says. They have not been covered. They're not covered. And even after this government, the Congress approved these packages, we still have gaps that allows us to leave ourselves and the country unprotected.
Let's look at now paid sick leave and family medical leave. So we had a victory at the federal level in the sense that we have this legislation that created paid leave, emergency paid leave for workers for reasons related to the coronavirus. But it excluded businesses with 500 or more employees. This is the FFCRA, the Families First Coronavirus Response Act. Contained a bunch of things, including these 2 emergency paid leave provisions. But unfortunately, it excluded huge numbers of working people. And then we have added to that businesses with less than 50 employees can opt out of the coverage with respect to leave for closed daycares or school closings. This was a really important victory in the sense that family medical leave, the FMLA generally does not cover things like daycare. If you lose your daycare, you can't use FMLA for that. This was huge because it meant that people could stay home and take care of their children because schools had closed down or daycares had closed down. So this was really important. But then it allows businesses with less employees to opt out of that. And the AFL report notes that it's estimated like 50% of low-wage immigrant workers work for employers who have less than 50 employees. So this is, again, a huge numbers of people who aren't gonna access this relief. Although there's no explicit exclusion of immigrant workers, the leave is restricted to the formal economy and traditional employment relationships. So what does that mean? That means that the whole gig economy in which many immigrants work, and the gig economy, these are independent contractors or they're misclassified as independent contractors, they are also totally excluded. Then you add to that the informal economy, domestic workers, day laborers, they are also excluded from this. So these are pretty huge exclusions. So Shannon, here again, this was, as I said, here it's a victory. Yes, it's a victory, but the gaps here are tremendous.
Right, the gaps are tremendous. In this instance, they don't target the immigrant community specifically in terms of the exceptions, but by exempting large employers and small employers in the informal economy, we have mass, a portion of our workforce that's sort of been excluded from these protections. So, we'd like to see much more comprehensive federal coverage, and we know that this is an area in which states are sort of stepping in to provide additional paid leave provisions, which are critically necessary. We know some of the most basic guidance that we have is that we need folks to be, if they're experiencing symptoms, staying home, and we need to ensure that their livelihoods will be protected in that context, regardless of what their status is.
And Yanina, we know that Latinos generally are pretty young. Many of them are working age. They have children. So these kinds of leave provisions are really key. And unfortunately, here again, we see significant numbers of Latino workers being excluded.
No, definitely, and that's why in our report we speak, right now we're speaking in the context of the pandemic, but we have to, in order to actually understand that, we have to see the conditions that these workers were working before, what kind of rights they had, and what kind of access they had. in order to actually have a better picture. So as moving forward, trying to put remedies to this one, we take into account what is it that we really need to do in order to change that paradigm.
Let's look at now unemployment insurance. Obviously, a huge important issue given the gigantic record number of people now out of work and who desperately need access to unemployment. Here again, we have a victory for workers in the sense, generally in the sense that the federal legislation included a $600 weekly supplement to unemployment. This was important because unemployment, these are state programs, but they don't pay all your lost wages. So the supplement is significant. And it included coverage for workers, many of whom are usually excluded from unemployment. So people who are independent contractors, people who may not, who may work part-time. So it included those folks, which was also really important. As I said, that's most definitely a victory. But an overwhelming majority of undocumented workers are ineligible for unemployment. The good news is that DACA and TPS holders should be covered, but again, we're going to talk about their whole programs are in jeopardy right now. So that's certainly an area of concern. But the millions of undocumented workers who are thrown out of work during this pandemic, almost none of them are going to be eligible for unemployment. And then states have a limited potential to experiment with unemployment programs due to the restrictions that come from federal funding. So states that need this federal funding aren't going to be able to extend it to groups like the undocumented in order for them to partake in the program. Is that right, Shannon? Do I have that right?
Yeah, that's right. And I think, the reality is, right, that the leading up to the crisis, right, 1 out of every 20 working people who got up to, report for work every day lacked formal papers, right? And we know that the concentrations are much greater in many of our industries, vital industries, right? Construction, hospitality, service industry, agriculture, domestic work. And so we know that these are folks who've been providing vital services with, on average, they've been here more than 12 years, working. And yet when times get tough, and we see the unemployment numbers skyrocket, then all of a sudden there's this requirement that they have to be ready and available to work, right? Which is based on paper status. And so as a result, we see this tremendous injustice with people really with no safety net right now, and actually federal government limiting the options that states have to try to step in and provide that support.
And Yanita, what are LACLA's concerns with this gap, the inability of so many immigrant workers, particularly undocumented immigrant workers, not being able to access the unemployment, which is pretty key to keeping people, right, from losing homes, being evicted, not being able to make rent, even, right, buying food, taking care of their families.
Guillermo, precisely that I think it leaves us open to many issues to be either more abuse, to our economical situation being even worse than what it was before the pandemic got here. And we already had it real bad. The thing that would affect our children. And let's not forget that when we talk about undocumented workers here, we're talking about those undocumented workers are parents of US citizens. When those workers are not receiving that help, are not part of that to receive those benefits, we are also denying that to children that are born in this country, are US citizens. So that is important for us to understand. So that worries LACLA, it worries the health of our community, of the millions of people they have applied for an insurance. We know that a lot of them, as you said, are undocumented. It's a reality that more than half of the Latino households, we have either somebody not working or somebody who have reduced hours, that will be affecting their life, the everyday life, their ability to provide food for their families. And that is a concern.
So related to that is also the part of the report that deals with one-time cash payments. This is the money that we're seeing people are now beginning to see, right? The money that was allocated to try to help people more immediately. So here again, we have a victory for workers. It's the legislation that was passed provides $12 one-time payment per adult, $500 per minor child, and some protections against eviction. So obviously people losing work, having a very difficult time making rent, you know, this was most definitely much needed. But those who use an ITIN number, which stands for Individual Taxpayer Identification Number, ITIN numbers. This is the way undocumented people file and pay their federal income tax. They use ITIN numbers. Those folks are excluded. And to make matters worse, also excluded are any other members of the household, including U.S. citizen children. Now there's $450 million allocated for food banks, and many unions are mapping out where and how to make emergency food assistance available to vulnerable workers. This is something that the USW, we have members who do a ton of community work. So kudos to them, and keep doing more, because in a lot of situations, food banks may be the only way a lot of immigrant families will have access at all to food, frankly, because they can't access this cash payment, they can't access unemployment. So this is pretty dire. Shannon, would you agree?
Absolutely. I think that, you know, it's among the most cruel of the aspects of the response, that not only does it penalize people who've been dutifully filing their taxes for a long period of time, but it directly harms mixed status families, and those very you know, children of immigrants that Yanita was just referring to. And so, I mean, I think that we're looking at a real question about basic survival concerns for our families out there. And so I think that that has really elevated the sense of urgency around these other sorts of direct service provisions, such as food banks, eviction bans, other things like that, because we see just how many people are going to be excluded from the cash benefits that we know we need more of in order to keep folks together.
Yeah, and Yanita, there's this myth, right, that undocumented workers don't pay taxes, which is a myth. They do pay taxes. They pay sales taxes, pet taxes. They pay property taxes. They pay property taxes indirectly, as if they rent, all renters are contributing towards property taxes. They pay state taxes. They pay local taxes, and yes, they pay federal taxes, and yet they are excluded from this relief.
Yes, no, it's totally unfair. And I'm going to continue going back, Guillermo, that we need to revise where we're coming from, that it put us in this very bad position as immigrant workers, no? Why we ended up, we're the one who are dying, but we also the one who are being laid off every day because of the industries that we work. But we also the ones that are mostly renters, no? And so what that means when we don't have that we don't have access to those benefits. What would be the impact, not only currently, which is about health, our health, and we have to protect it, but in the future, when we start talking about the economic crisis that this is going to do, what it means for us. It means that we are more apart or away from even thinking that we can get a step towards being able to have a secure economic life with dignity in this country.
So this brings us to the immigration enforcement. This obviously gets a lot of attention in the news. It's worth noting here, arrest and detention of undocumented folks continues, and I'm talking about folks being arrested and detained for immigration-related violations. This means that these are people getting arrested and detained for no other reason than they lack status. That's continuing continuing despite the threat that it poses to the health of the detainees, as well as the DHS personnel who are still working in these detention centers. Family detentions continue. That means that children continue to be incarcerated despite the physical and psychological threat to the health of these children. A vast majority of immigration courts remain open despite opposition from the judges union. The immigration judges have a union, and they're rightly upset about this because it's endangering the health of asylum seekers. It's endangering the health of court personnel. I want to quickly move on because we're running short on time. We'll touch on this as well, but it's related to the next topic area: no comprehensive reform imminent and DACA TPS threatened. So pretty obvious for folks who've been paying attention that under this administration and Congress, there is no conceivable prospect for comprehensive immigration reform that would benefit all workers. This is the position of the AFL. This is the position of the United Steelworkers, and it is no doubt the position of LACLA. We have a broken immigration system. We need to reform it. We need to create a path for these millions of undocumented people to get status, get work authorization, and eventually become US citizens. That is nowhere on the horizon right now. And to make matters worse, we're looking at a million DACA and TPS holders are in danger of losing their status and work authorization, thus jeopardizing their jobs, access to emergency paid leave, unemployment, all the programs that at least they could access now, they would be in danger of losing out on should the Supreme Court decide that the Trump administration was within its rights to end these programs. So the impact of this, again, for hundreds of thousands of people is going to be dramatic. And then 25,000 healthcare workers. This really struck me, Shannon, in your report. 25,000 healthcare workers, and I have to assume many of them are exposing themselves to COVID-19 to save the lives of US citizens. They would become undocumented as a result of a court decision that ends these programs. So,
Right.
I don't know what can you say about
Yeah, well,
the
I
horror
mean,
show that continues?
I think I think that you've summarized it well. We know that our long-term fight has to be to ensure that all working people in our country have rights on the job, rights in the community. This is why we're committed to the long-term struggle for comprehensive immigration reform, right? Because we know that the way that we lift standards and we improve working conditions and raise wages is by expanding rights and protections so that workers can come together and fight together to improve our jobs. And so what we see here is the administration moving us backwards. Instead of giving more people status and rights, stripping it away cruelly from people who've been in our workforce and in our unions for decades. And so, this is a decision that the administration made that we expect, unfortunately, the courts to uphold. And so we really do see an imperative for congressional action to step in and extend the status of these folks and not further disrupt our workforce in the middle of this crisis.
And Yanita, obviously DACA, especially when we look at DACA, the Dreamers get a lot of attention. Of course, they're only part of the undocumented population, but this was super important to get this protection for these young people. It should be a step towards comprehensive reform, right? I know that LACLA's done a ton of work with Dreamers. What are they telling you, the Dreamers, right now?
Well, I think that we all get the message. They're struggling. We know we're facing the court. We're waiting for the court's decision, and it is important not only for the numbers because this is their country. They live here, and because of what they're working, they're part of the workforce. They're part of our community. But that also includes TPS holders. TPS holders have been here for more than 20 years, some of them, and they're also part of the workforce. They're also working in the different areas that right now are important sectors that we need to maintain in order to maintain the minimum that we have in order to keep the country running. So it is important not only comprehensive immigration reform to fight for our rights in order to improve our lives, as Shannon says, but it's a fight for human rights. I mean, no document should be the reason why somebody is denied the opportunity to have benefits to actually survive in a pandemic like the one we have right now. No document should be the reason why they're denied of access to testing and vaccine and the benefits to sustain their family. No document should be a reason to forget that they're humans. And that we have that responsibility. That's why it's important. It's important that this document, the AFL put in this document, it's important that we send a message to the immigrant communities to say, we're with you, we understand. Because we are a whole, we won in this country. And the only way history has shown to overcome this is working together.
So let's finish up then by looking at what's needed. These were the recommendations of the AFL's report. First of all, adequate worksite protection and access to testing and treatment for all workers, regardless of status. All workers who pay taxes should be eligible for cash benefits, unemployment, and nutrition assistance. Essential workers with DACA and TPS must have their work permits automatically extended for the term of the crisis. And all practices and policies that elevate risk of exposure should be suspended, including immigration detention and deportation. So this has been a lot of information to cover. Certainly hope that folks look at these reports. The most important thing is, of course, is that they get involved in this fight. Shannon, these are the real takeaways of your report, right? This is what we need to make happen. How are we going to do this?
Well, we got to continue to hold our federal representatives' feet to the fire, make clear that this is, it's a core fight for the labor movement, and that we know that none of us are safe until all of us are safe. So, so I think this is a message that we all need to be sending as loud and as clear as we can. Clearly as we can, and we also have to acknowledge that there's a big role that our states and our cities can play to try to plug some of the gaps that we've seen in the federal response, and there's been a lot of exciting victories around the country, and so looking close to home as well for how we can ensure just these sort of really core things like access to, medical coverage and to benefits that can help to weather the storm, I think are going to be critically important both in the middle of this crisis and as we seek to emerge together as a labor movement stronger and to try to address some of the real structural problems that the crisis has helped to highlight and make clear that we need to continue to fight to fix.
And Yanita, what is, I'm sure LACLA embraces these recommendations.
No, we do. But I'm going to repeat this one. We need to understand where we come from. Why is it that this pandemic is hitting our communities so bad? Because only understanding that, we're going to actually move to what they say, to understand that none of us are safe until all of us are safe. But moving forward, we cannot go back and think that we're going back to the same that we were before, because the same, where we were before, it was already bad for our communities. And that's why we find ourselves in the situation that we are right now. And that's why we're reading what we're reading. So we cannot go back to the same. We have to move forward, finding ways how united we can find new paradigms that would actually represent all workers, but workers, immigrant workers.
So to wrap things up, we're encouraging everybody who's hearing this webinar, seeing this webinar, and obviously we hope you participate on May 1st when Yanita will be back with us to talk more about actually LACLA's report that focuses on Latino workers. We're going to do some Q&A live via Facebook, but I want folks to know you can learn more. This is a link to the AFL-CIO's report. It's on their website. This is a link to the LACLA website that has their report. as well. I want to thank both Yanina Merino of LACLA, Shannon Lederer of the AFL-CIO for joining us in this important discussion. To all my brothers and sisters and siblings out there among the steelworkers, stay safe. Hope to see you very, very soon. Oh, and join us on May Day. Take care.